fundoscopic finding in systemic illness. Fundoscopy, also known as ophthalmoscopy or retinoscopy, same thing. So you see mainly the fundus and you see the peripheral retina. What are the findings in systemic illness? So I have grouped most of the disorders that can be diagnosed with fundoscopy, starting with the classic ones, which are cardiorespiratory disease. I mean, not by default, but let's talk about the fundoscopic finding in different systemic illness, starting with the classic ones. So let's first talk about the COPD. If someone has COPD, he has carbon dioxide retention, and this usually leads to papilloedema. So you will have blurring of the optic disc margin and swelling of the optic disc. Then comes diabetes mellitus, and sequentially, initially you will find macroaneurysm and then dot hemorrhages. And then if the hemorrhages are bigger, that's called a blot hemorrhage, dot hemorrhage plus a blot hemorrhage. And then you will get the hard exudates, which are actually lipid depositions. And at the end of the day, when there is excessive proliferation of the vessel, you call it the neovascularization. This is also known as a proliferative diabetic retinopathy. The previous ones are not proliferative. This is non-proliferative, but neovascularization means you have a proliferative diabetic retinopathy. Then comes hypertension, which may also occur in pheochromocytoma. So the findings are the same. It all starts with increased refractiveness of the vessel, known as the silver wearing. And then there is compression of the veins by the arteries, because arteries become thickened, and that's called AV nipping, where the veins become compressed by the arteries. That is called AV nipping, arteriovenous nipping. And then you get what is called soft exudate, which are actually retinal ischemia, that is soft exudate. At the end of the day, you get what? You get the grade 4 hypertensive retinopathy known as papilloedema. That is the end stage or the most severe manifestation of hypertensive retinopathy. Then let's go to some infections, starting with infective endocarditis. Usually the patient has something called a Roth spot, which is the center is pale and the periphery is red. Then go to the TB. In TB, you have many things, but classically, you have choroidal granuloma. And malaria, you also have Roth spot, just like infective endocarditis. Next, CNS disease. In multiple sclerosis, you get blurring of the optic disc margin. That's called papillitis. And usually this papillitis leads to a color blindness. And then if someone has a long-standing multiple sclerosis, this can lead to optic atrophy. Then CVST, cerebral venous sinus thrombosis. This leads to a raised ICP, and obviously it will cause a papilloedema. Then hematologic disorders, starting with anemia and leukemia, they have two common features. Number one, the flame hemorrhage. Number two, the Roth spot. So you see, Roth spots are present in hematologic disorder and two infections. And the infections are infective endocarditis and malaria. And in hematologic disorder, another common one is flame hemorrhage. And you can also see flame hemorrhage in patients with hypertension. Hypertension may also cause a flame hemorrhage. But special with severe anemia, you may get cotton wool spot, just like hypertension. So hypertension can cause cotton wool spot. Severe anemia can also cause cotton wool spots. So those are the classic fundoscopy findings. If we go in a rapid way, COPD, papilloedema due to carbon dioxide retention, diabetes mellitus, non-proliferative, macroaneurysm, dot and blot hemorrhage, hard exudates, and proliferative is neovascularization. Hypertensive patient, severe hypertension, starting with silver wearing, then AV nipping, soft exudates, and the grade 4 is papilloedema. Infective endocarditis and malaria both causes Roth spot. Tuberculosis causes choroidal granuloma, Multiple sclerosis causes papillitis and optic atrophy. CVST causes papillary edema. Severe anemia, leukemia, both causes rot spot and flame hemorrhage. But severe anemia can cause cotton wool spot, just like hypertension.